Hi, this is Leanne Jalon with San Juan Basin Public Health, serving La Plata and Archuleta counties here in Southwest Colorado. Happy New Year. This is our first weekly update of 2021, and we have lots of new developments to share. In 2020, our primary focus was performing disease investigation and control for COVID-19. As we begin 2021, we're excited to now have several safe and effective vaccines to address this pandemic. This means that in 2021, our work will both be disease control and investigation and beginning to distribute and administer vaccines. So we know the question on everyone's mind is when and where can I get my COVID-19 vaccine? And we want to assure everybody that as soon as we get the information, we share it with you as quickly as possible. And in fact, we're developing new tools to share information with you through our website and through email. Right now, though, I'm going to go through the information we have now and then tell you how you can sign up for these alerts so that you can get this information as soon as it becomes available. As of last week, Governor Polis announced an expansion of Colorado's phase prioritization for vaccine distribution. We're still in phase 1 across the state of Colorado. Most counties are in phase 1A, some have moved into 1B, but we're going to talk right now about what all of phase 1 looks like. Phase 1 now includes an expansion for all adults over 70 years old and many new categories of frontline essential workers. 20 to 25% of Coloradans are now included in phase 1. This means that phase 1 is a monumental distribution undertaking, and lots of infrastructure, resources has to be built, and providers have to be added to the effort at the same time that vaccine is rolling out. In order to do this, the state is making smaller categories within phase 1. They're called phase 1A, and then they're called phase 1B. And phase 1B has two sections. There's the above the dotted line section and the below the dotted line section. So to be clear about where we are locally right now, we have been assigned by the governor as local public health to ensure that local public health is prioritizing the finishing of the vaccinations for 1A, top priority, highest priority healthcare workers. And then local public health has been assigned to also ensure that moderate risk healthcare workers and the first responders in phase 1B are also getting vaccine right now. The goal is to have this group finished in the next couple of weeks. We want the highest risk healthcare workers finished by January 15th and the first responders in this group finished by the end of February. At this point, the state can also start working through the rest of the 1B, including the largest group of everyone who's over 70 years old. The state has assigned this large group of 70-plus-year-olds to hospitals, to healthcare, to pharmacies, and to safety net clinics. We're also working across the state to set up additional points of distribution for that category, and those plans are actively being worked on. But just to be clear, it has been assigned by the state of Colorado that everyone over 70 should receive a vaccine at a healthcare facility, at a hospital, at a pharmacy, or at a safety net clinic. We'll be watching this closely, and we are very anxious to ensure that everyone over 70 in our community has access to a vaccine. Concurrent to this, staff and residents at long-term care facilities across the state of Colorado are being vaccinated by the federal program's Pharmacy Partnership for Long-Term Care. Here locally, we got a head start on that program and worked some of our vaccine into these facilities to make sure that our facilities were not left behind. The state expects that throughout Colorado, by the end of February, the phase 1A top priority healthcare workers, the 1B moderate risk healthcare workers, and individuals over 70 will be complete. This then moves us into March, and in March, the state believes that we will all be ready to vaccinate the additional frontline essential workers in phase 1B, including teachers, childcare, and other essential services. Please be aware that these assignments are given to us by the state of Colorado, and we are being asked to follow the phases very closely. While some Colorado counties have started transitioning into 1B, not every county will be in the same phase of distribution at the same time due to the size of the county and the availability of vaccines. The availability of vaccines is changing every day, and Colorado is working really hard to distribute it equitably across the state. But given this current limited supply, we do expect it will take months for everyone who wants the COVID-19 vaccine to receive it. We appreciate that so many people in this community are interested in getting this vaccine, and we also appreciate your patience and understanding that we are moving through this process and releasing information as soon as it becomes available to us. With that, we know that residents are interested in really up-to-date information, so we have created a form on our website that you can fill out. It does not make an appointment for you, but what it does is it collects your information. You put in what phase you believe you're eligible for, and when we get to that phase, we will use the information collected on the website to ensure that a notification goes out that vaccine is available, and this is where it may become available. We also want people to understand that as the system grows and more hospitals, healthcare facilities, pharmacies, and other points of distribution become available, information will also be available in other places. So we all need to keep paying attention and getting information everywhere we can until we can get our appointments and get our vaccines done. The last thing for today is that we're very grateful that vaccines are being distributed and that our communities have such strong partners helping distribute vaccines as soon as they arrive in our region. We're particularly grateful for the collaborative partnership with all of the hospitals in our region, especially Animas Surgical Hospital, who has agreed to take on a tremendous role in ensuring equitable distribution across our region. Getting the vaccine is an important step to protecting yourself and others from the virus and will help us eventually get our communities back to normal. Everyone's opportunity to get vaccinated will come, but it will take some time. We're headed in the right direction. Unfortunately, there is still high transmission of COVID-19 in our communities. We want to work together as communities to lower our transmission rate, bring down the amount of disease in the community, and allow our schools to be open for in-person learning and allow businesses to remain open. We're asking everyone, while we are focusing on bringing vaccine to the community, to please remember we have to remain vigilant and practice the following steps to control the spread of COVID-19. Please continue to wear your face mask, continue the social distancing, stay at least 6 feet apart from other individuals, avoid being in indoor spaces if it's a non-essential activity. Please get tested if you're symptomatic, if you think you've been exposed, or if you're working in a high contact role. Please follow quarantine guidance promptly if you've been exposed. And remember, it's still all of our jobs to protect people at highest risk from catching COVID-19 and experiencing severe consequences, including significant illness and death. We can still postpone travel. We still can work on increasing our hand hygiene, working on better ventilation in indoor spaces, protecting essential workers by only making short necessary trips. And finally, the last step is also finding out when vaccine is available to you and getting your vaccine so that we're all continuing to be in this together and we will get through this. Thank you.